about emotional health and mental health, and in an effort to maintain our collective mental health, I think it's important to focus on the good that is happening in our lives and sharing that goodness with each other. So I know the last couple of weeks I've tried to start off the coffee hour by having everyone share something good or something that they're excited about, and I want to do the same thing again today. So in the chat box, please, if you could share something a positive side effect of your quarantine that you found. I know for me personally, I have rediscovered the park in my neighborhood. I've lived in my house for 7 years, and I think I visited that park once 7 years ago. But I have been taking walks every day, and I've rediscovered beauty that was nearby that I had forgotten was there. So focusing on the good things that we're discovering, even though times are a little tough right now. Oh, a new puppy. That is exciting. Yard is looking great. Oh, books are getting read. 2 virtual 5Ks. Wow, that's dedication. Cooking. So thank you so much, everyone, for sharing. And I'm really enjoying, oh, birds. Oh, wow, that's my husband watching birds at the bird feeders, how he's spending his day every day as well. Book club. So thank you, everyone, for sharing that. And like I said, I'm going to try to focus on a positive thing to get these hours started. I also want to go through a few housekeeping things that I address every week. Please make sure that your microphone is muted unless you are unmuting yourself to speak. We do have everyone on camera that wants to be on camera. You also have the option to unmute yourself, but out of respect for everyone else that's talking, please just make sure that your microphone is muted unless you are speaking. Right now, I think we all of us collectively have a lot more questions than we have answers. But I know for MLA staff, a lot of the questions that we've been getting are revolving around human resources and legal requirements for reopening. So with that in mind, we are really excited to welcome Carol Stone with us today. She's the Director of Human Resources and Labor Relations for the City of Midland, Michigan. And she's here to help answer some of the questions that we've been getting. So I know I forwarded her questions that we got in and things that have been coming up a lot over the last few weeks. So she's here to address some of those and talk to us about human resources in the time of COVID-19. And we will have time throughout the presentation for questions. So again, like always, please feel free to unmute yourself and ask that question, or if you are more comfortable typing it into the chat box, you're welcome to do that as well, and we will read it for you. So it is now my pleasure to welcome Carol. Good morning, Carol. Thank you so much for joining us today.
Good morning. I'm really happy to be here. And I had to be honest, I'm a little intimidated because librarians are the experts at research and information. So I feel a little bit of pressure here. So hopefully I won't disappoint. I will tell you that if you have questions that I can't answer, I will get those answers for you and I'll send them to you, Amber, and you can get them out to everybody. All right, so let's just jump right in. Except for my screen doesn't want to advance. Huh. There we go. So our agenda for today, we're going to cover our state and federal COVID-19 requirements, when layoffs and furloughs make sense, and how you go about doing that, how unemployment works or sometimes doesn't work, so if you listen to the news reports today. What about retirement and offering incentives, and then ensuring your employees' morale and mental health as we go through this whole process. So I'll just jump right in here. We're going to start with the Families First Coronavirus Response Act. That's the act that provides paid leave time for your employees. It's in effect from April 1st to December 31st. For your full-time employees, you have to provide 80 hours of sick time or paid leave time, and the equivalent amount for your part-time employees. This is in addition to any other paid leave that you provide your employees, and it applies only to COVID-19 illness or quarantine. One of the questions that was asked was, can you require documentation? You can, but that's a little sometimes difficult for the employee to get. So if they don't have like a paper slip from their physician, you can ask that they provide the name and the agency of the person that put them in quarantine. So sometimes it'll be, it's a contact tracing kind of thing, and the health department contacts them and says, you've been exposed, you need to quarantine. So they may just be able to provide you just that name and the agency that put them in quarantine. It also can be taken intermittently. So if you have a employee that is taking care of a family member with COVID-19, they can say, I need 4 hours a day. so that it doesn't have to be taken all at once. It also expands the Family and Medical Leave Act so that employees with child care issues can be home taking care of their children. The first 10 days of that are unpaid, but you can require, or they can request to use any paid leave time they have. And then the next 10 weeks are paid at 2/3 of base salary. And it's important to note here, and I actually had to ask this question because we have furloughed employees, because I anticipated that we would get employees that would say, oh, I want to exercise that Family and Medical Leave Act before you furlough me. You have to have they have to be actively employed, and you have to have work for them to do. So if you furlough employees, they can't say, oh, wait, I'm going to take the Family and Medical Leave Act. You also have to post this somewhere within your facility. That's one of the requirements, but that's a little difficult to do since we're all closed. What I have done was, we have an employee website. I put it on our website, and then I emailed it to all the employees so that they had a copy of it. And I've put a link in the presentation to the poster that the federal government wants posted, so you can just use that and send it out or post it how you deem fit. So are there any questions on the Family First Coronavirus Response Act? It looks like no. All right, we'll move on.
Oh, actually, Carol, we did get one in the chat.
Okay.
It just says, what if our employees have no internet access? How would we get that information to them at that point?
You might want to mail a copy to them. It's only a one-sheet thing, so it'd be really easy to pop in the mail.
Oh, great.
Next up is the CARES Act. That's the Coronavirus Aid, Relief, and Economic Security Act. That's the act that got us all the stimulus payments, but it also expanded access to unemployment benefits. So part-time employees that were previously not able to get unemployment are now eligible. Unfortunately, I can't tell you what that threshold is because the state hasn't released it. The Midland furloughed about 128 employees, and the only one so far that has been rejected based on hours worked was a school crossing guard that had made only like $1,000 in the last quarter. So I think maybe the threshold might be pretty low, but I can't give you a hard number on that. That also includes that $600 per week federal subsidy for unemployment. That payment is made in its entirety, even if the employee is only getting like, the minimum unemployment is $18, so they would get that $600 even if they were only getting $18 in the state unemployment. Michigan also eliminated the requirement to seek work while unemployed. So yeah, that's certainly an option. Is there any questions on the CARES Act? Nope. Okay. We'll go into furloughs a little bit later in the presentation, so I'm sure there'll be questions there.
Carol, I had a question come through. Who pays for the FFRCA sick? Is it the library that pays for it?
For the sick leave?
Yes.
Yes. So for the private sector, they're getting relief on their payroll taxes for that. But for nonprofits and public sector, there's no relief put in. So yes, the employer pays for that. Next on our agenda is the state requirements for reopening. That's Executive Order 2020-59. That requires that you adopt a written workplace prevention, preparedness, and response plan. And they've specifically referenced a publication by OSHA, so I put a link there. It's a really good reference because it'll take you step by step, but it's a 32-page document, so I wouldn't recommend adopting that as your workplace prevention plan. One of the things in the OSHA plan that I didn't like was that it actually has categories of risk for employees, and I'm a little reluctant to put those in a document that I send out to employees because some of them are already a little freaked out about coming to work, and if you designate an employee as high risk, no matter what mitigation you take, they're going to be a little intimidated, I think. So I didn't put that in the plan that I have, and I'd be glad to share that with you. I just put in our plan that we would analyze the risk and adopt measures to mitigate that risk for the employees. So you have to analyze the risk exposure for each position, implement measures to reduce that risk, and that includes, cleaning and sanitizing, social distancing, personal protection equipment, house screenings. Then you have to provide that plan to the employees and educate and train them on components of it. So we'll delve a little bit deeper into that. Cleaning and sanitizing, you have to consider everything like furniture, work surfaces, customer service counters, shelving. Shelving will be big in the libraries, break rooms, lunchrooms, restrooms, even down to like door handles and light switches, and determine who's going to do that, how frequently you're going to do it, how you're going to do it. But one of the big things is shared equipment. If you have copy machines that everybody has access to, how are you going to make sure those are clean and disinfectant? Are you going to require that people wear gloves when they use them? And then you also have to consider items returned by the public. How are you going to make sure those are cleaned and sanitized? For employees, you also have to determine social distancing and how you're going to maintain that during the workday. Some of the things we looked at were restructuring schedules. Are we going to have everybody come in at the same time? Are we going to stagger shifts? Are we going to have people, reduced hours so they're not working their normal times so that we're able to maintain those distances? Also take a look at your physical locations and your workstations. We're actually redoing some of our workspaces to make sure that we can maintain that 6-foot distance. We're installing sneeze and cough berries at customer service counters, and also like here at the Human Resource Department, we're an internal service customer service department, but we also have employees coming in and talking down on employees, so we're also installing those at some of our internal service areas. You can require and must provide PPE, that means masks and gloves. I suspect that when we reopen, masks will be mandatory, and you can require the employees to wear them. If they are medically unable to do so, you can require that they provide documentation of their inability to wear the mask. If they just refuse, then you're in disciplinary mode and you need to discipline them because they're putting other employees at risk. One of the things we've also taken a look at is in-person meetings. We've prohibited those in our plan unless absolutely necessary. And then we've put measures in place that if you're going to have one, there has to be hand sanitizers and you have to disinfect before the meeting and disinfect after the meeting. So I think it really goes in depth. And then you also need to implement procedures so when you do open to the public that they can social distance. So that means putting markings on the floor where they should stand, and just like in the grocery store, the one-way aisle. So the plan can get pretty intense, but I personally thought it would be important to keep it readable. So a 32-page plan, an employee is not going to read. So I think mine's about, like I said, about 4, and the employees have read it and have asked questions already. Health screenings is another thing. The state hasn't required it. It hasn't issued a requirement for it yet, but they did require it for manufacturing. So when the big 3 open back up this week, they have to do health screenings of their employees, and that includes like a health questionnaire at the start of each day and then temperature checks. And if an employee arrives at work sick or has a temperature, you can send them home until they no longer have symptoms. So that could be pretty important, and probably will go a long way to help some of those employees who are fearful of coming back to work, to know that you are screening employees and making sure that people that are coming in the building are healthy. And then when you look at public access, are you going to require masks? Are you going to limit capacity? And what about house screenings? Are you going to have somebody ask your public about those questionnaires? And how will you ensure social distancing? So, it's a very involved process and takes a little bit to put together. So I know libraries are closed for a little while yet, but so that gives you some time to work on it, and probably good to start now.
Hey, Carol, we had a question come in the chat about the temperature checks.
Yes.
How does that affect HIPAA rules if you're taking employee temperatures every day?
It's allowed under HIPAA now. They've loosened up a little bit on that because of COVID-19. In fact, you can, you can let employees know that they've been exposed from another employee now. I wouldn't release details of that, but you can let them know that there was somebody in the building and they were exposed. But health screenings and temperature checks are allowed under HIPAA. You probably should have one person in charge of that and maintain those records confidentially, but it is allowed.
Thank you.
Mm-hmm. So anything else on the?
Well, there was one question that just said, would it be more logical for employees to check their own temperature at home before leaving rather than when they show up at the door?
You can also request that and then have them certify when they get to work that they do not have a temperature.
Okay.
That is also an option. Yep.
And then Kat, I don't know if you're able to unmute yourself, but you had a question that says, would our reopening plan be able to include this? But I'm not positive what this refers to.
Like the when we're talking about some of these safety precautions for the staff members and the training, is that instead of having a separate like document just for this, could that be included in the general reopening plan that I have laid out?
You probably could combine them into one document, just as long as you meet the requirements that the state's laid out.
Okay.
They're just looking to make sure that you take measures to, you know, keep your employees and the public safe. So as long as you have those in some document and communicate it and train your employees, that should be fine.
Because I have talks about that, and I also reference that OSHA document within the reopening plan, because one thing the OSHA document calls for is like a quarantining station within the library, in case someone were to have symptoms and not have a ride home, basically. You would have a place for them to go and
Have
wait.
somewhere to put them. Yep.
So stuff like that, I mentioned that we would set up like one room as per the OSHA guidelines, and I mentioned the document.
That's another good point too, that if you have it included in your plan, has to be a procedure for if somebody does become sick with COVID-19, how are you going to handle it? You know, their workstation needs to be clean and disinfected before people can be back in that area. So you need to have procedures in place to quarantine that off and get it clean before you can allow people back in. Okay, move on here. So now we'll talk a little bit about when and how to furlough or lay off. Technically, a furlough and a layoff accomplish the same thing. Generally, layoffs refer to longer term or more permanent reductions in the workforce, and a furlough is of a shorter duration. Some of the things that you need to take a look at when considering it is your funding levels and the impact on your budget. We took a look at how we thought taxpayers would feel about continuing wages if we are unable to deliver services. It helped for us to make the decision when we knew the state had expanded eligibility, and that some of our employees with that $600 subsidy will probably make more on unemployment than they actually made when they worked. If you are a reimbursing employer with the state, which means that you don't pay the unemployment tax, you reimburse for claims paid out, the federal government will cover 50% of your unemployment claims. And if you structure it as a temporary furlough, the state will pick up the remaining 50%, which means if you furlough employees on a short-term basis, you will have true savings. There will be no additional cost. You will save on the wages and you won't pay anything out on unemployment. That makes it really attractive in terms of the budget. Okay, I thought there was a question there. You could also, well, I'll cover this in a little bit more detail, but the state also offers a work share program, and that might be something that you want to take a look at. And then if you have positions that can work from home and can do it productively, do you want to continue those? And we're actually now at the point where we have some positions that we're wondering if, do they really need to be, long-term forever come in, every day? Can we just leave them on homework for the long term? It seems to be working out really well. When you make the decision to furlough or lay off, you need to consider your union contracts. I, up front, when we made the decision that we were going to furlough, met with the union reps and let them know what we were doing and why. The union contracts usually, or maybe even your work rules, contain procedures of how you do that layoff. For libraries that are completely closed, it's probably a little easier because you don't have to worry about seniority and laying the less senior off first. And you also have to look at bumping rights. We laid off citywide, and bumping rights was a huge thing. We took the position, contrary to what the contract said, that this really wasn't a true layoff, that it was a short-term reduction in the workforce that was caused by COVID-19. And the restrictions placed on us really didn't facilitate letting somebody bump into a position that they hadn't done recently or if ever. So we took the position that we weren't going to allow bumping. We've had one grievance, and we'll just process that grievance through its entirety. But we just didn't think bumping would work for us in terms of what we were trying to accomplish. And then the other thing to consider is, what are you going to do about benefits when you furlough or lay people off? Are you going to maintain health insurance benefits? We made the decision that we would. This is something that was thrust upon the employees as well, and we didn't want to take away their health insurance benefits when they could potentially have health issues with the coronavirus. And then what about your pension plans? If you're in a DB, defined benefit plan, will service credit continue? And what about these months where they will have no income reported? Will that be included in their final average compensation. And then if you have a 401 or a defined contribution type plan, are you going to continue to contribute to that plan while employees are off? I will say that if you're in the MERS pension system, they're offering a temporary benefit change that you can adopt. It remains in effect through December 30, no longer than December 31st, but you can terminate it earlier than that if you bring people back to work. And then it grants service credit for furloughed time and also ignores those months with no income when they're determining final average compensation at retirement. So that's something to consider. There should be no cost for additional cost to your plan for that because the plan already assumes that the employee is actively at work. And then if you're going to proceed with the layoffs, you need to provide a written notice to your employees. You need to include the anticipated length of the layoff. And then I also included instructions on how to file for unemployment as a benefit to our employees. So any questions on furlough and layoff?
We actually have had a few. One before we get to the furlough questions, we had one that came in about the quarantine space. And if you had any recommendations about small libraries that don't have any separate space, how they would handle something like that.
That's difficult, isn't it? Maybe if you can put them in an office, your private office, until they're able to arrange transportation home. Maybe drive them home, have somebody drive them home. But again, whoever they're gonna be exposed then. So you may need to make sure that personal protection equipment is provided to them, masks and gloves and disinfecting wipes and all that. So that's a tough question.
That is definitely a tough situation to overcome for sure. So I know there's a lot of smaller libraries that are trying to wrap their head around how to approach that problem. So one question that says, if we furlough staff, are we still required to pay back unemployment money?
So no. So as I covered earlier, so if you're a reimbursing employer, meaning that you don't pay the federal unemployment tax, and most public entities I think are probably reimbursing employers, the federal government's going to cover 50%. And if you structure it as a temporary leave rather than a full layoff, and there's information on the state's unemployment website on what they need you to say. I think it's something like you're being furloughed or a temporary leave for no more than 120 days. The state's going to pick up the remaining 50%, so you would have no chargebacks to you for furloughing employees.
You mentioned earlier a work share program.
Yep.
Can you describe what that is?
That's my next slide.
Oh, wonderful. Okay.
There's more unemployment. So you can, if you wanted to figure out what the impact would be on your employees, the formula for unemployment is 4.1% of the highest quarterly wages in the last 18 months to a maximum of $362 per week. Benefits are reduced if they work, but they can work some and they can earn up to 1.5 times that weekly unemployment benefit amount. So if they were at the max of 362, which really equates to like an annual salary of 365 or 35,000. A lot of employees hit the max. They can earn $543 a week and still receive something in unemployment. And that's important because in order to get that $600 subsidy, they have to receive some unemployment benefit from the state. So if you're going to reduce hours and have people work part-time, they can still qualify for unemployment, but you need to watch what they're earning because you could be harmed financially. So the Work Share program was really put in place to provide an alternative to like manufacturing doing total layoffs. And under the Work Share program, you reduce the hours, all employees in a group by the same percentage. So let's say I have my library aides and I'm going to reduce all of their hours by 20%. They would get paid for the 32 hours that they worked, and then they would get 20% of whatever their unemployment benefit would have been had they been fully laid off. So if they were at that 362, they would get 20% of that $362 benefit. Because they were getting something from the state, they would also get that $600 per week federal subsidy. So I figured it out, and at my salary, I would be further ahead to have my hours reduced by 20%. I would be financially ahead with a $600 per week subsidy from the federal government. A couple things on the Work Share program. If you are unionized, you need to get I don't know if permission's the right word, but you need to get agreement from the union that they want to participate in the work share program, and it has to be approved by the state. And it has to be, everybody in the group has to be reduced by the same percentage. So yeah, and you're responsible for determining what those groups are. So you can do your administrative staff or everybody in the same union, but excuse me. But you have to determine what that is, and there has to be a minimum of 2 people in the group, and you can reduce wages by 10% up to 60%. That certainly provides an option, especially for when you return to work and may not want to return everybody to work full time because you'll have reduced hours or reduced public access. So that's certainly a viable alternative for that.
Carol, there is a question that says, you know, we keep hearing messaging about employees making more under unemployment, but there are many people that have still not received unemployment due to the system slowdown. Do you have to keep track of the numbers of people you've let go who've successfully received their unemployment?
No, you don't necessarily have to keep track of it. There's no question that the unemployment system is overwhelmed. We furloughed people on April 14th, and they're just now starting to get their payments. So it is a long process. And so we're monitoring it pretty closely. But no, there's no technical requirement that you maintain, track it and keep lists of it, keep records of it. I think probably you would want to, but there's no requirement that you do that.
Okay. And if libraries utilize the work share program, do they still have to pay benefits?
Well, if your employees are at work, you probably would pay benefits, yeah.
Do you know of any concerns that the system for unemployment is going to run out of money based on the amount, the number of people that are applying?
No, so the governor actually addressed that question this week, and the program is pretty healthy. In fact, it's one of the healthiest in the country, so it's unlikely that it will run out of money. So I think they're pretty well positioned to handle the number of claims that they've had so far. They've also hired additional people to process those claims quicker, so that's one of the things you need to consider when you're making the decision to furlough people is how long will they go before they receive any type of check from unemployment.
Mm-hmm. And I think that I just see one other question. Are there any thoughts on unemployment or any of the federal relief for substitutes who may work 2 days a week, 1 week, and maybe not again for 2 more weeks? So my thought was to let them apply and see what happens. But people that might have inconsistent schedules or varied hours.
Right, because the state has not released what that threshold is, the minimum income to qualify for unemployment, it's hard to give an answer to that. So, so if you were going to furlough them, that they would, right, I would take a chance and see where it went. They have to have a certain, a certain dollar amount of wages in their highest quarter, but I have no idea what that is. Probably unlikely working that schedule that they would qualify.
Okay. Oh, and thank you. That's what she thought. So that was the comment. And then how do we find out the minimum income to qualify?
I haven't been able to find that out. I've asked and asked, and they just haven't released that information. But like I say, we've furloughed part-time employees. So far, the only one who has not qualified was one of our school crossing guards, and I think he made about $1,200 in his highest quarter, which is not very much, and they said he didn't meet their criteria. But they've not released what that is, so it's difficult to say.
Yeah. Is there an end date for the $600 subsidy?
End of July.
End of July. Okay, thank you.
Mm-hmm.
And I think
I know one of the questions. Oh, go ahead.
I was say I think that addressed all the questions that have come
The
through.
one question that was on the list that you gave me was, what about if they don't return to work because they're going to be making more on unemployment than they are as actively employed? If they refuse work, they're no longer eligible for unemployment benefits. So if you have if you can return them to their position and they say no, they'll lose their unemployment benefit.
Okay.
And then what about offering retirement incentives if you have people that are close to retirement? If you're in a defined benefit plan and depending on your funding level, they can potentially offer a temporary window that would encourage retirement. You could offer a cash settlement to encourage people to retire. But whatever you decide, you need to offer it to everybody that's eligible, or you'll be open to an age discrimination claim. So you can't say, oh, employee A, I know you wanted to retire, we'd like to facilitate that, here's an extra 10,000, and have employee B who's also eligible, but you don't want them to retire. That's an age discrimination claim in way, you know. So you just need to make sure that whatever you offer to everybody that's eligible. And you need to put those offers in writing and include language that it's a voluntary program, that they have 21 days to consider and 7 days to rescind the agreement after they accept it. So, and I would advise that if you're going to go down that route, that you seek legal counsel so you structure things the right way. I've done that at previous employers and it's worked out well, but again, seek legal counsel on that one. And then employee morale and health is really important now. We have people that are really fearful about coming back to work. So you need to maintain regular contact with employees, email or call at least weekly, provide updates on what to expect and when. If you have an employee assistance program, send out reminders of their services, because they're still, they still have access to that. I am still sending out our employee assistance program newsletter. I email it. I think it's weekly, and so I email that out every week. I've had all of our departments get the personal email addresses of employees, so if they're not accessing their city email, they still get those emails. And I've emailed articles and tips about getting through the pandemic. And I know some employees are fearful of returning to work. Talk to them about the specific measures that you're taking to ensure their safety. And at some point, it's a big issue. I know we have some that are fearful as well. At the end of the day, if you take all the effort, all the measures that you can to mitigate their exposure, if they don't return to work, you're kind of in a disciplinary mode. The ADA doesn't apply, OSHA doesn't apply. For them to not return to work, they have to be in imminent danger of a safety violation or an illness, and that's not happening if you take all of those mitigating efforts, the social distancing, the personal protection equipment, the cleaning and sanitizing. So I think it's more talking through with the employee what their fear is, and trying to come up with measures that you can implement that will reduce those fears. Any other? Oh, I know. Go ahead.
Yeah, so just going through some of the questions that came in ahead of time, and then we'll open it up and see if anybody has any other questions. How would you handle staff who are exhibiting cold-like symptoms but insist that they're not sick?
Well, I would send them home.
Mm-hmm.
I would send them home and tell them they can't return until that they don't have any symptoms anymore. And you legally have the right to do that, especially now. And that's one of the things, that you talk about the area where you can quarantine somebody that's sick at work and doesn't have any ability to get home yet. That's one of the things I think that is an argument for the screening. And I think you really need to emphasize with all your employees, don't come to work if you're feeling sick. If you come to work that way, you're going to be sent home.
Mm-hmm. In terms of the quarantine, there was one question that came through about libraries that maybe don't have a separate space. Does it have to be an enclosed space, or could there be like lines marked on the floor that there's just a designated area where people could be quarantined? Does it need to be its own separate room?
So, I think probably a separate room is probably ideal, but if you don't have that and you quarantine off a space and make sure everybody stays away from them and everybody wears protection equipment around them, we have to do the best we can. It's not an ideal situation. So I think any measures you take to protect employees from exposure is the best that you can do sometimes. But again, I think if you do that screening ahead of time and you really emphasize to employees, do not come to work if you're feeling sick. Hopefully none of us will be in that situation.
Mm-hmm.
Carol,
go
sorry,
ahead. Sorry, Rachel.
Another question that came through about employees returning to work. What if the employee is high risk? And is there room for them to return?
Is there room for them to what?
Continue to work remotely and not be forced to actually return to the library.
So I guess that depends on, that's an individual decision of the libraries, right? And how productive they can be working from home. I think you need to be careful though, because this is the cynical part of me from HR. If you do it for one employee, are you going to open the door and have more employees that want to do that? And can you accommodate all of those? So if you're going to do that, be careful how you do it. Tie it to somebody that has not just a fear, but somebody in the home that has a compromised immune system, and they're afraid to bring it home. Tie it to specific criteria so that you're not faced with all of your employees wanting to do the same thing.
I just lost my train where I was reading. So what is your opinion, Carol, on travel and how it impacts employees returning to work? Is it considered good practice to have staff traveling out of the area to self-quarantine when they come back? And how would they define out of area? I guess what does workplace travel look like after this?
So we've prohibited all workplace travel until probably until there's a vaccine, I'm going to say. We're just not allowing it. I guess we'll consider on a case-by-case basis if it becomes necessary, but I'd prohibit all travel out of the area until we're in a better position to deal with COVID-19. We've also put in a policy in place that if you travel personally, if you take a vacation somewhere, you're going to quarantine for 2 weeks when you come back, especially if you're traveling to a hot spot. So until things, I think, get better, until we have better treatments available, until we have a vaccine available, until things open back up more, we've taken the position that if you travel, we don't want to expose our employees to what you might bring back with you. So if you we're not saying you can't travel, but if you do travel, you're going to quarantine for 2 weeks when you come back.
Does that quarantine have to be paid, or do they have to use PTO? How would that work?
So on the personal travel, no, they have to use their own time.
Okay.
I suppose since we're quarantining them, they could probably use the 2 weeks under the Family First Act, because that, we're a public agency and we're quarantining them. So they could probably use that, but otherwise it's unpaid unless they have their own paid leave time.
Thank you.
That Family First Act, that 80 hours, that's a one-time thing through December 30th. So once they use it, it's not available again. So if they get, quarantined now and quarantined 6 months from now, that they don't have that to use again.
Mm-hmm. If there's a library that has an employee that is in a high risk category, but they want to return to work and they want to do whatever's asked of them, is there any liability on the library's part if that employee does get sick?
Not if you take the, actually Congress is actually looking at that, right? So for me to say no is probably not fair, but if you take all those measures to mitigate their risk, you give them the personal protection equipment, you clean and sanitize, you put up barriers, you screen employees, I think you're minimizing any liability that you might have.
Great. Oh, we're getting so many questions and I'm having a hard time keeping up, everyone. With the whole discussion around unemployment, how would that affect libraries who pay an unemployment tax?
So the governor, in one of her executive orders, did put in place that if you are laying or furloughing employees because of one of her executive orders and the whole COVID-19 situation and restrictions on work, there would be no impact on your unemployment.
Okay. And and maybe this is something that's part of the plans that everyone would have to draft, but how do they define exposure to the virus? So if there's a library and somebody in the building is test positive, is everybody or all employees in the building then considered exposed, or is it only people that are in close contact? I guess how far does that go?
I haven't seen any definitive recommendations on that. We here in Midland, we're taking it on a case-by-case basis. So I work in a private office. If I don't have any exposure to anybody, then maybe it's fair that we don't have to close down the whole facility. We close my office and disinfect it. On the other hand, you have to look at, did I use the restroom? Did I use the lunchroom? How about the shared copy machine? So it's not an easy answer, right? Because you have to kind of track where that employee has been and how much contact they've had. And if they've had a lot of contact, all of those areas have to be cleaned and disinfected before you can return people to that work area. So potentially you could have to close the library depending upon how active and involved that employee was.
And I know you addressed this a little bit, but we did have several questions, and hopefully we can just touch base on this again about employees that refuse to wear a mask. And really, I know you addressed that a little bit, but best practice for dealing with that. I know you talked about discipline. The question that came in says, we give a little bit of wiggle room for religious or medical reasons or other reasons. But for someone that won't wear a mask, do they assign them to work in a location separate from others if possible? And they added that this person is an anti-vaccine, pro-alternative medicine, and was seen at the grocery store over the weekend without a mask. So it's a problem that they anticipate to continue, and just what the best practice for dealing with a situation like that.
Again, one of those difficult questions, right?
I think there's a lot of difficult questions in this conversation.
I would be concerned about the message that was sent to the rest of the employees. The whole idea of the mask isn't necessarily to protect the employee themselves, it's to protect the people that they're dealing with. And I think that needs to be emphasized to employees that, we're protecting everybody here. And unless they have a medical or religious reason, I would just require it and go the disciplinary route if they refuse to do it. I don't think it's too much to ask for employees that when they can't social distance, that they put a mask on. So if they have a private work area that they can work in, they don't have to wear their mask while they're in it. That's the position that Midland has taken in our return to work plan, is that I'm in a private office, I don't have to wear a mask while I'm in my private office. Unless somebody comes into my office and I can't social distance with them, and then I'm going to put the mask on. If I leave my office, if I use the restroom, if I use the kitchen, if I go to the copy machine, the mask goes on, because I'm walking through other people's work areas to get to those things. So I think you need to be really strict about the masks unless they have a medical or religious reason that they can document for not wearing one.
Mm-hmm. Yeah, I think, you brought that up as well, just opening that up for liability if you allow one employee to do something and not the others, and how that snowballs. So I think that's good advice. And then changing gears a little bit just from the mask, I know we had a lot of questions about that, but I was wondering if you could touch on maybe some best practices or tips, ideas for managing work from home employees. So I know a lot of libraries do have their full-time staff and people that are working remotely. How do managers maintain levels of productivity and, make sure that their employees are actually following through on their assignments when they're working remotely? From an HR perspective, is there any kind of best practice for managing that workforce?
This is kind of new for government, right? I think probably communication is the key. You need to be in pretty frequent communication with the employee and get updates on how they're progressing on the assignments that you've given them. And you'll know if things aren't getting done. Mm-hmm. I think probably that's the best way, I think, is to have Zoom meetings if you can, but for sure maintain contact so that you know where they're at and what they're doing.
Mm-hmm. Great. Rachel, have we had any other questions come in on your end? Nope, I'm not here. Okay. And then just going back to the work from home, we did just get one that said, what are the best practices for tracking their hours while they're working from home, if they're an hourly employee? That's really difficult because it's hard to know when they work. And I guess if they're logging into your system, you can see how many hours they've worked logging into the system. But I think you're going to have to base it on the productivity and the completion of assignments that you give them, and have trust that your employee is doing the right thing, because there really is no mechanism for making sure that they're working when they say they are working. Yeah, I think there's a lot of new territory for everyone. So a lot of kind of figuring out how this is going to work best for each organization and each library, each community.
Carol, this is Debbie. How do you deal with an employee who says they got COVID by returning to work? What's the liability for the library?
So workers' comp has taken the position that that unless you're public safety and can trace it to an exposure through the job, that it won't be work related. They won't be considered work related from our workers' comp. And I think it's going to be really difficult, especially if you take those protective measures that you have requirements in place for cleaning and disinfecting. You make them wear their masks and sometimes gloves. You do the house screenings. It's going to be difficult for them to make the argument that they got it from work.
It'll happen.
I'm sure it'll happen. Yeah, I'm sure. That's one of the things Congress is actually looking at in the next aid bills, including something in there about when employers open back up, that they won't be held liable if their employees contract COVID. Because there's no way really to know, did they get it from the grocery store or did they get it from work?
Mhm.
And do you have any inside knowledge? I know we're all trying to figure out when we reopen and things like that. What's your best guess about the contact that is had at libraries, and what stage would we be in under the governor's reopening plan?
No official inside
Your
information
opinion.
on that. But I think my opinion is I think libraries will not open up right away. I think they're grouping those libraries in with recreational opportunities, and I think you'll see that extend out a bit more, and maybe allow things like the pickup kind of thing, but not open the facilities fully for a while probably. It's going to be hard. Like, how do you on a children's program socially distance people? Yeah, it's going to be very difficult to administer, I think.
Yeah. Well, and actually that's a good opening that I know next week we're going to talk a little bit about some of the children's programming and youth programming and how to do that. So that's a good segue that you just added in there, Carol. I appreciate that. And then, like we just asked about returning, can you touch on a little bit if one of the questions that we got, so that they had to lay off 10 employees, but they are facing a situation where they are considering maybe not being able to bring all of them back. How do they approach recalling employees if they can't bring back everyone that was laid off? Do you have any?
That's a tough situation. Well, first of all, you need to look at if you're unionized or union contracts to determine how you bring those people back, if seniority comes into play in bumping. So you have to look at that when you're calling people back. And then it's just a hard conversation about, where we're at financially, and we just can't bring you back right now. So you're going to continue to be laid off, or, maybe even if the position is eliminated, it's just making that tough decision and communicating with the employee. Not easy.
Yeah. I think there's a lot of difficult decisions and plans that everyone.
Kind of keep you up at night.
Yeah.
Carol, we had another question come through related to unemployment. The question is, my library is continuing to pay all employees their average number of hours worked. Most are part-time. Should we have laid them off so they can get unemployment, since they will be financially better off given the $600 a week? Or could we do that now? And what are the downsides for the employer to do that?
So you can do that at any time. So there's no like set date to do that. So you can make the decision that, we just can't continue to do this and we're going to lay you off at a certain point. I don't know that there is a downside to the employer except for employee morale, because it's a hard message to employees when you say we're gonna lay you off. So you need to craft that message thoughtfully to make sure they understand they're valued, and you want to bring them back, but you're just not in a position to do that right now. And so you want to position them in the best way. And because of that $600 federal subsidy, from now through July, they're actually in most cases making more on unemployment than they would just working their part-time hours. So there's some benefit there to the employee to kind of ease that message.
Are there any other downsides for the employer, or are there any positive sides for the employer to doing this?
From the employer standpoint, if you are on a direct reimbursement with unemployment, it's a huge cost savings, because you're not paying salaries and you won't have any additional payments for unemployment, because those claims are being paid by the federal government and the state. So it's true savings for the employer.
Carol, this is Debbie. If you're not a reimbursing employer, I know there's another term for that, but won't that show up on a yearly basis when on the percentage of how much unemployment needs to be paid then?
No, if you're doing it based on one of the governor's executive orders that have put restrictions on you and you can't have employees in the workplace, then it will not impact the taxes that you pay for unemployment.
That's perfect.
You won't get the same benefit necessary. I guess it's cost savings because you're not paying salary. So yeah, I guess you do get the same benefit. And it shouldn't impact what you pay in your unemployment tax.
The another question just came in about what is a reimbursing employer, and that's probably more municipally based.
So public entities with the state can be a reimbursing employer, which means that instead of paying the federal unemployment tax, you just reimburse the state for unemployment claims that were paid out on your behalf. So it's they bill in arrears and they bill quarterly, and you pay for the claims that were paid out for you. The Michigan Municipal League actually administers a program that helps with that. So if you want to get more information, I'd refer you to the Michigan Municipal League unemployment program. But that should be available for all public employers.
We're actually going to have Dan Gilmartin in a couple of weeks from Michigan Municipal League talking with us, and that might be another question that we ask him directly as well.
Yeah, thank you, Carol, for throwing in multiple segues to upcoming events. We appreciate it.
Wasn't even set up ahead of time.
So the question just says, if we pay the Michigan Municipal League quarterly, is that what we are? Are they a reimbursing employer?
Yes.
Okay.
Yep, that means you're in the league's unemployment program, so yep.
Do you have a good source, Carol, for where you're receiving information? Is there any resources or websites that you're checking regularly to keep up with all of the changing HR implications for public entities?
I check the unemployment website, I check OSHA, I check the CDC, I check the Society for Human Resource Management, which is the national or international professional organization that most HR directors belong to. I check the International Public Management Association for HR, and I check with our legal counsel. So I'm maybe I should have been a librarian because I'm researching it all. I don't know. I try to get as much information as I can because I want to be able to talk to the employees and let them know what we're doing and why and what they can expect.
Mm-hmm. Thank you.
And I'm happy to, like, if you want to send the participants my contact information, I'm happy to answer questions that they might have along the way.
Oh, wonderful.
This is a tough time for people.
Carol, are you also willing to share your 4-page plan? I know everybody.
Yeah, absolutely.
Good. Everybody's looking for what's the next best idea, and we hate to reinvent the wheel. So if somebody's already done a little bit of our work, we'd love to see that.
Yep, absolutely. I just can't imagine an employee reading anything more than 4 pages. So, I mean, a 32-page plan from OSHA is just overwhelming.
Yeah, that's not light beach reading either.
No.
It's definitely so. Well, right now we have about 5 minutes left, and we can wrap up early if there are no other questions, but I want to give everyone one last opportunity. I know, Carol, I appreciate it so much. We've thrown a ton of questions at you today, and you've done a great job, but a question. In terms of the plan, should we make employees sign something or acknowledge that they have, in fact, read that plan?
Yep, that's always a good idea. Kind of hard to do until you actually have people back at work, but yes, I would have them acknowledge they received it. If you send it out electronically email, just having them acknowledge back through an email I received and read the plan will also work.
Okay.
Just anything that you have that can document that they've read it.
But that documentation is a best practice to have that documented,
right,
that they did agree to that. Okay.
Yep. But when you bring them back to work, I would also have kind of like a mini training session on what's in that plan and what they're required to do so that they're clear again on what the expectations are.
Mm-hmm. That's a great idea. Thank you. Do we have, in the last few minutes that remain, and I know we're getting a lot of thank yous and great information and Carol, you're a rock star, I think came through.
Thank you.
But are there any other questions that anyone has? There will, a lot of questions about being recorded. We are recording this, so we will post this. And I know we've put some of the links that Carol shared in her presentation into the chat, and we'll make those available as well. And I'm not seeing a lot of other questions come through. So thank you. I think we'll end it here. Thank you so much, Carol.
Thank you.
Thank you, Debbie and Rachel and Lisa, so the rest of the staff at MLA helping put this all together. And thank you so much for all of the attendees for joining us today and taking some time out of your day to learn with us and talk with us. We will have another one of these next week. Like I said, we're going to talk about some youth services. So please soon about that. And I hope everyone enjoys the rest of their day and enjoys the sunshine. I know it's sunny here, and I can't wait to go on that walk and explore that park again. So, and I cut you off, Carol. I'm sorry. What did you say?
I said it's beautiful outside. I was agreeing with you. Get outside if you can, but safely. Maintain your social distancing.
Exactly. Thank you for that. So
Yep.
with that, everyone, have a wonderful day, and we will see you all soon.
Bye. Thank you.